Litha Healthcare has operations in pharmaceutical, biotech and medical devices. Now, your headline earnings for the year increased by 45%. This does take into account that you had the Pharmacare and Litha acquisitions only effective last year, May. What were the key revenue drivers for you in 2010?
Well, for 2010, post the acquisition of Litha Healthcare Holdings and Pharma Africa, we introduced the vaccines, the biotech division, as well as the pharma division. So for us, the big drivers has been obviously medical, which is the mainstay, in terms of the volumes and the sales, and vaccines have now come in with high turnover. Margins aren't as high as in the medical and the pharma, and then pharma as a much smaller division.
Let's take a look at the biotechnology unit. Key revenue driver for you. You supply most or all of the pediatric vaccines to the public sector through the Biotech Institute, as you say. Now you're going to be building manufacturing capacity here. How is this going to improve margins?
Well, our manufacturing capacity is being set up, and we're in the process of completing that program for 2013, where we'll be introducing the first product. Up to now, we've been distributing. It's been purely a logistics business, where the margins are low.
With imported products?
All imported products, and we supply all of the vaccines that are used in the pediatric schedule. So as children are born from 0 to 5, they get vaccines free of charge, and we supply those vaccines. And obviously, when we start manufacturing, the margins will be bigger, and as we manufacture the products, and it'll really start in from 2013 will be the first product, and then further products after 2013, 2014, 2015, the margins will certainly improve.
Let's talk about the project pipeline in terms of funding for this build of manufacturing capacity. You've got a 75 million rand loan from the IDC, a 2.4 million euro grant from the Italian government. What other funding do you need?
Well, all the funding now has been sourced. We've got all the funding for this particular program. So the IDC was the last bit of money that we needed, and that's now been secured. So we're now in the process of doing all the upgrades, putting all the equipment in, the clean rooms. That should all be complete by Q1 next year, that's 2012. And then that'll allow us time to do all of the validation runs in 2012 so that we can be ready in 2013.
With the government's stronger focus on healthcare through the NHI, what impact is this going to have on your vaccination business, given the fact you've already got a strong partnership with the health department?
Well, I think on the vaccine side, government had been one of the forerunners in introducing new vaccines into South Africa. And I don't know if you remember, but in 2008, they included the rotavirus and the pneumo vaccine, and they were one of the first middle-income countries to do that. So as a program, the South African government have a very well-organized program. It supplies, it takes care of all of the antigens that are needed, and that's what we supply to all the clinics for them. So
what really I'm asking is, what scope for growth is there in terms of penetration in the South African vaccination market?
In South Africa, we supply all of the vaccines to the public sector. I think for us, growth is into Africa.
Okay.
So it's really looking into Africa, into the NGO, looking to supply World Health Organization and some of the other NGOs, and as well as some of the countries direct. So it's really an export-driven expansion program.
Let's take a look at your pharmaceutical division. Only 11% of revenues come from this division, but you have said it's a strategic focus for you, the generic side of the business. How do you intend to compete with the big competitors like Aspen, which achieve economies of scale and so can afford to reduce their prices?
I think for us, scale is important in the pharma business, and it's something we're looking at carefully. We are looking at some acquisitions in the pharmaceutical space, as well as some licensing arrangements on tail brand products from the multinationals, as well as some non-performing pharma brands that we can look at acquiring. But I think that does take time. It's not something that will happen immediately, but we are working hard as well to fill up time. And if you start applying for registration, between 2 and 3 years to get registered. So we really need to put together a strong pipeline of products over the next 3 to 5 years that will start getting approved for us to be able to compete.